Michelle.
Hello, Brian.
I know.
Yeah. Brian, you are seeing the third window, right? Can you name that window as content? Content?
Yes, sir.
Content, or you can just put like class notes.
I know.
Sorry, could you repeat that?
Class notes.
Class notes? Okay, I can name it.
So just grab one of these seats over here. Okay, I'm going to get you guys to move in a little bit closer. I know. Come on in. It's just, you all look great. Just coming closer. Move in. All right. I know you did.
You can move it much further so that.
Over that way. Right in a little bit closer. Okay.
Can we hear?
Sit over here. Getting everybody to move in a bit closer, be friendly. There we go. Thank you. Come on in. Who else are we waiting for? We got a couple of others. All right, come on in. Thank you. Moving a bit closer. Okay. All right, we need just a couple more people up front here, I know. I know you have to go earlier. Tracy, you coming up front? Yeah. Okay, so let's get Callie here. I know you're eating. You can. Okay, so Rachel, you're coming up front. Rachel's coming up front. You're gonna flip a coin. I'm gonna get you to come up front. Everybody doesn't want to be up front. Everybody's trying to hide. Come on up, Melon. Come on in. Okay, everybody move in. All right, I gotta get people to move up a little bit. Okay, yeah, she's taking notes. So you gotta. Rachel, closer. No, in one of these seats over here. I'll sit right in front. You can sit behind me if you want. Okay, so here, that's okay. We'll watch ourselves, right? Okay, come on in. Come on, Michelle. Let's move in a little closer. Let's go. Flip a coin. Okay, here you go. Oh, Rachel, you need to come up. Come on, Rachel. Rachel, see, there we go. Thank you, Rachel. Good. Everybody's afraid to come up close. So, okay, so move it a little bit closer because we're going to have this. Yeah, have it. This is a good one. And you get the microphone, too. Here, come on this side over here. Okay, perfect. So we move everybody in. Nobody wants to be up front of the camera. There you go. Okay, we need one more seat filled here. I'm going to pick someone. Nobody wants to be in the front.
I think Callie's done her muffin.
When Callie's done her muffin, she can come up here. All right, one more person just up here. Just one more person. One more. I'll be right in front of you. There you go. You have to. Perfect. Okay, that way everyone can see. I know it's all coaxing, but it's okay. Yes.
Is it okay to move the camera?
Yeah, it's okay to move the camera. Who wants to move the camera?
No, I will move the camera.
You'll move the camera. Okay.
But I'm saying like nobody has reservation, right? Like if I'm moving the camera.
Yeah.
Everyone like okay to be.
Is everybody okay with that? You're not too worried about that part? Okay, perfect. All right.
I know, I was bitching about my room.
And then we'll just get started.
This is live.
Okay, so see, there you go. You can see yourself. Are you okay? Here we go. There you are. Well done.
Oh.
Everybody's worried to be up front on camera. I know. Nobody wants. There you go.
Come a little bit closer to this.
Okay, a bit closer. Yep.
A little bit so that you fill the screen,
Okay.
you and Dan.
Perfect.
So
Yeah. All right.
I don't know.
All right. So we should do the intro now. So I'll introduce our class. We have our class today is a little shy. Nobody wants to be on camera. Everybody's tired. But we have our 6th semester dental hygiene interprofessional practice class. And we're very excited to have both Erin and Jenna here, who are specialists in migrant workers internationally. I will let you go through your resume because you probably want to indicate the things specifically that you want to bring into this talk. First of all, I'd like to thank Dane Record for setting up this talk for us to better understand the plight of the migrant worker, and also to sort of help us as healthcare professionals understand the challenges that are faced by these people on a daily basis, and how we as healthcare providers, as dental hygienists, future dental hygienists, and current dental hygiene students, how we can actually make a difference in the community. So thank you very much for being here. We really appreciate having you here. And we'll let Dane start the discussion.
All right, so hello class and everyone else that's on the air and on the airwaves. I guess a brief introduction to how I do my work, how I approach the work. I'm the Black African and Caribbean Outreach Coordinator at the AIDS Committee of Durham Region. We're a community-based AIDS service organization just down the road, actually, in Oshawa. We serve as far west as Pickering. We go as far east. We're allowed to go as far east as Newcastle. Sometimes we fudge a little bit. And we go as far north as Beaverton. The work that I do with my program is working primarily with the Black community, so African and Caribbean communities. And I'm working to prevent and educate communities on HIV stigma, disclosure, and prevent new incidences of HIV for all communities, but in my work, it's working primarily with the Black community. My work is guided by the Ontario HIV strategy for African, Caribbean, and Black communities, or just for short. We use a lot of acronyms in our work, so it's the ACB strategy. So in your work, in your field, you may see ACB, you might see Black, or. We're essentially talking about the same thing in our work. How does an HIV outreach worker get involved with working with rural agricultural communities? Well, in this work, understanding that our rural communities, especially here in Durham Region, we are working with a number of farming communities where they do employ seasonal agricultural workers. They're workers from the Seasonal Agricultural Worker Program. It's a federal program through the Government of Canada that's been in place for, I guess this was the 52nd year or 51st year, sorry. It started with 263 Jamaican workers who came to Canada because there was an employment shortage in agriculture, so on the fields. And the farmers were seeking employment from Canadian laborers, residents looking to help out with the agriculture. Let's get to work, and they were not successful in getting as much employment as they could. What they did, they reached out to other nations, other communities, and were able to connect with Jamaica, who sent some workers down to help with the work shortage. Going down the line now, 52 years later, we have workers here all across Canada, but in Ontario and in the region. We have workers from Mexico, Jamaica, Barbados, and the Eastern Caribbean islands, who do participate in this seasonal agricultural worker program. When we're doing this work, so again, connecting to how does an HIV outreach worker do migrant worker outreach? When I'm out and educating communities and educating Black people about the work that we do, when I have to understand that I'm working, educating, and preventing incidents for everybody. This includes our rural communities. This includes our agricultural communities. So for those out there that are thinking that there's no Black people out in the farms, yes, there are. There are farming communities in Beaverton. There are farming communities in Tillsonburg. And there are Jamaican workers and Mexican workers and other farm workers in the smallest communities. But the best thing the best way to find out is to just say hi and just be neighborly. That's how we approach the work, and that's how we've been approaching a lot of our work in our respective communities. When we're connecting and getting to understand the workers, to find out the guys and the girls who come, and we ask, what is it that you need, or how can we make your non-work time a lot more enjoyable instead of just go home. What do you need? How can we help? One of the things that we're often asked is there anywhere that I can go to see a doctor? My feet hurt. Or is there a dentist that I can connect with, that I can speak to? Is there a walk-in clinic? And for some communities, for some people, just the term walk-in clinic, this may be something that is new. This is a new terminology for some folks. So when we're out in the communities and connecting with farmers, we need to always be mindful that a doctor could be somebody who's checking the body, could be somebody who is checking maybe an oral doctor. So for you students in here, you could be on the field working with us as well. More on that a little later. But there's many different ways to just using that example, say that we do have medical care and medical availabilities in the community that you're working with and that we all live at. Let's connect you. The common misconception that we hear from residents and community is that, oh well, they can go to emergency the same way that I go to the emergency clinic, or they can go to the doctor the same that I can go to a doctor. In the work that we're doing right across the province, we do understand, or we have a general understanding that we need to meet people where they are in their lives and where they're at. And in some cases, that 9-to-5 clinic, that 9-to-5 doctor might not meet the farming schedule that the farmers are working in. Like sometimes they're starting as early 6-7 in the morning and going till 6-7, maybe even later at night, depending on the time of the season. Where are they going to get their medical attention? This is where we come in. We set up pop-up clinics. We create opportunities for medical staff, medical doctors, occupational nurses and doctors to connect with the farmers in their communities where they are. And we do our best to provide the best care that we can from a community's perspective. So that could be something as simple as, we have somebody here who speaks Spanish who can assist you along the way. That might be a small thing and something that just goes over my head, but that might be like a barrier buster for somebody who's been here for a number of years. We've now just created a great opportunity for them to receive optimum care when they're here and when they're best available. Understanding that the work on the farms could be anywhere from 6 days to 7 days a week. We work when we're doing our work. We're working during their time, during their schedule. So it means working in the evening. It means that we're going out on weekends, and we're out in the communities to serve. And we often serve in many different respects. Like we're here right now with dental students, and we're going to be talking about oral health, I guess, probably after our time. but we're fielding questions such as, where can I go to a dentist? Or can I talk about my family just for a moment? I just want to speak to somebody. Or where can I go to church or go play cricket? A number of things that we encounter and that we in our work, but it's all something or some things that we address as best as possible, and that's the key thing about doing the mobile work and being able to just be modular in the approach. Meet the communities, meet the farmers where they are in their areas, and just address matters as they come, and refer and bring the service to the communities, to the farmers, to the seasonal agricultural workers. What I'd like to do at this moment, I just want to throw it to Jenna, because Jenna's doing some amazing work out in Laurier and Waterloo and in other communities, and she'll be able to just bring some matters to the audience. So Jenna, if you want to go ahead.
Thank you very much. That was a really great introduction. Hello, students. Hello, everyone in the class. Can everyone hear me?
Yes.
Everything good? All right, good. I'm doing a lot of work right now at an international level on raising awareness around issues around migrant farm worker health, migrant farm worker rights, and migrant workers more broadly. Over the last 15 years, I've done research on migrant workers in Canada and have done studies focused on migrant worker health in agriculture, as well as access to rights, and a host of other issues. The work I'm doing right now with the UN is, I think, illustrative of the fact that the problems and the issues that we're going to talk about in the context of Canada, in the context of Ontario, in the context of small regions in which we might be working and living, actually are part of much larger global processes and trends. I think it's important for us to learn across those contexts. So I thought I would start by going up a little bit out, and then we'll come right back down to our local context. So just to give us a sense of the numbers, we're talking of between 244 and 247 million international migrants around the world. And out of those, roughly half are women. And over 105, around 110 of those are migrant workers. They're temporary migrant workers. In Canada, we have numbers that vary from year to year in terms of how many temporary migrant workers come into the country, but they come in a range of different sectors. Agriculture is one. They also come in construction, services, and also at the high skill level. But broadly speaking, we have between 200 and 300,000 temporary migrant workers that enter the country every year. In agriculture, have roughly 30,000. We have a long-standing program with called the Seasonal Agricultural Worker Program that has in it the seasonal agricultural workers has both Caribbean workers, so the program started in 1966 with an agreement with the Organization of Caribbean States, and then later in 74 established an agreement with Mexico. So right now under that program we have between 20 and 30, and then around an additional 10 under a different program. They come from all over the world, so Cambodia, Thailand predominantly, and so and also in Guatemala, from Guatemala. So we have migrant workers in agriculture in all of our communities from all of those countries. So to pick up a little bit on the earlier point that our rural communities are actually quite diverse in periods of the year, and that diversity we might not see translated into the number of patients that come in through the door. And that's not because they aren't there, because they can't necessarily access services. So when you look into the broader skilled and the broader range of migrant workers that come into Canada and actually that move around the world globally and work in a variety of sectors around the world, they encounter health challenges from before they migrate, the process of traveling, to once they're in host communities and they're working, they encounter occupational health issues, and then on their return. But I think an important point is that when migrants are living and working in our communities, they don't, they're whole human beings whose entire health picture or reality is compartmentalized and often very difficult for them to take care of because of the kind of challenges that they face. So while they might be working in an industry that has high rates of injury and certain kinds of occupational illnesses like musculoskeletal difficulties, for example, they also have a great deal of exposure to chemicals. They have difficulty getting access to clean water, and they have poor protection at workplaces. But all of those things compound, or as you know, as students who understand the way health works, is that we don't have, one part of our body is health over here, and therefore the other parts are separate. They're all interconnected. So for migrant farm workers, really only access to the healthcare system will be when they have an acute situation, when they've had an injury that's significant, and it winds them up in a hospital. That's the primary way that they encounter the healthcare system. Beyond that, it's at GSF, and there's a whole host of barriers that range from access to transportation, to language, employer mediation or control, to isolation, to hours of clinic, that mean that they aren't receiving other kinds of primary health care. That said, migrant workers in Canada can, in legal sense, access and have access in right to primary care, but there really are significant gaps around supplementary care. And indeed, the way it works is basically migrant farm workers, temporary workers, for the most part, will not have access to supplementary care systems. They will not necessarily be able to, have their eyes checked, have their teeth checked, and to deal with things that would be covered out of our provincial healthcare system. And so on top of the barriers they already have facing the Ontario healthcare system and the OHIP parameters, so they're also faced by these other scenarios where they typically don't have access and aren't covered for supplementary care. Learning from some other contexts, in the United States, for example, lots of research has documented access to dentistry and prescription medicine is a real problem for migrant farm workers. And in another case, in Cambodian farm workers in Thailand are similarly facing issues around access to these kinds of care. And I think from a holistic care perspective, we see migrant workers generally facing real difficulty in accessing that care. For women migrant workers, they also face compounded access to care issues, very specific kinds of health issues such as reproductive health are largely neglected in terms of being able to have access, but also in practice, if there is a situation where a woman migrant worker is looking to be able to receive reproductive health care because, for example, she is pregnant, then she may risk losing her employment, both present and future. She may face deportation, etc. These are things that are embedded into the program or other levels of structural types of barriers to access and receiving care, which is their right. stop there and say I'm welcome to have lots of conversations about the nuances of all of those things. I know I just fired up a lot at you, but as a starting point, and I know that Ron has got some very good first-hand, recent examples that he can share with you. So go ahead, Ron.
Okay, thank you, Jenna. Thank you very much for the invitation to share some of the experiences that I have living with migrant workers since 12 years ago. I do field work in Mexico. I do field work in Canada, and now I am doing field work in Niagara region. So I would rather start like a conversation with the students and listen some of the questions. Just I want to mention two things that are very important. Okay, this program doesn't allow to the migrant workers that travel with their families. So we have to mention that the woman or men, because they are both working here, but they come by themselves. The family stay in their countries. So it's a very big problem for them because they really are isolated in Canada. The other thing is that they are not really temporary because they come, the most of them with the statistics spend more time in Canada than in their countries. Talking about Mexicans are 25,000 every year working in Canada, and more than 50% spend more time here. Come like a year after year for 10, 15, 30 years. So we and the other thing is that this under this program is not prepared to give answers to attend the migrant workers in many ways. Like if we talk like related with laws or rules, you know, they follow, the rules are the same, some of them the same for Canadians, but others not. But in practice, you have your car, for example, and you are allowed to go to the work clinic. But then, at what time? You know, you have access. So some of them they work like for 12 hours. So when they need, the clinic is closed. Some of them are afraid to talk because if they say that they are weak, they can be deported right away. You know, so start just when you are here, like living every day with them. You know, you start realize that kind of things. If you just come like a student or researcher or as a tourist and visit them for a few days, you are not going to see, and probably you will have the picture that, oh my gosh, they are amazing, they are privileged. Some of the people think that they are privileged because they get like $11 or $12 an hour, 3 or 4 times more than in Mexico, and they just reduce all the life or this idea that they get more dollars than in Mexico. So as students, I just endorse you to, if one day you are gonna face with people like migrant workers, just you have to start preparing now and studying and just open your brain and your feelings to try to understand this kind of program. And this kind of program is not just in Canada, it's in a lot of countries like England, Australia, even Mexico, you know. So as a student, I just try to endorse that. Just prepare a lot, read a lot, visit migrant workers, open your heart, open your feelings, open your brain to understand. And it's very complex thing, takes really a lot of years to understand how these programs works. Okay, so just I would like to start maybe a question. Thank you.
Okay, any questions about migrant workers? So I think one of the things that we kind of want to understand a little bit more is we do understand that there are certainly the barriers to access to care. and also what everybody was mentioning is that they can't necessarily find time within our a regular day framework to go in and see a doctor or to see a dentist or so on and so forth. So really from our students' perspective where they're at now, dental hygienists can technically practice independently, not right after they graduate, but after about a year's experience. So I think probably something, because it's really sort of understanding the situation. And Aaron, you were talking about one of your situations, one of your workers that you said was having foot problems and where to go. And I think what we kind of want to find out is how we can create a niche within the migrant community to sort of reach out, because we're kind of, even from my perspective, is how can we walk in there and kind of, so we can't automatically say, hey, can we help you with your teeth, but how could we sort of help to involve ourselves in that community, even from our perspective, as instructors, as students, as future dental hygienists, because with this particular group, we have a really outstanding group that wants to go out in the community and help. And I think now that they've really actualized their ability to make some differences in the community and in our profession as interprofessional health caregivers. So how could we best sort of facilitate that from your experience? Because maybe sort of understanding some of the other challenges that women are facing, because as Jenna brought forward, 50% of our migrant workers are women. How could we sort of find ways to get into that community?
Can I quickly interject just to say that in agriculture, women migrant workers are less than 50% in Canada. But between the two programs, they roughly estimate to around 10%.
Oh, okay. So we have about 10%. So even male or female. So what from your so how Dane's sort of the person that can interact, but how can we as a community, as coming from so we're coming sort of from academia, but at the same time we have this facility where we can help people. But how could we best facilitate that? Any ideas from your experience?
Ron, you want to go first?
Yeah.
Aaron, yeah.
Okay. First of all, we have to understand the culture, the differences, culture, and we have to start thinking like some countries or some citizenships are better than others. This idea of colonialism has to start, we have to start working to deconstruct this idea, because even we can say, oh, some Canadians, we are very open, this is a multicultural country, but just deeply we still have like some colonialist ideas that we are better than the others. So first of all, we have to start see the other as a human. It doesn't matter what they come from, if they deserve to be here, if we are helping them to give them jobs. So that's not the way I think that we have to follow.
Can I add to that, Ron, to say that
Go ahead.
many migrant workers come from contexts in which they actually have access to these kinds of care that they might be needing in their home countries. And in fact, migrant workers are screened. Their health is something that is part of the screening process for their admittance to come here. So they tend to arrive in Canada healthy, and the kinds of health challenges they encounter here and the kinds of barriers they face in access to care are what actually compound and create problems for their health. And so the fact that I think it's, and this is to pick up on Aaron's point about our perception, that we need to unpack that, set aside that perception that people coming from other countries that are doing farm work are going to be poor and have terrible health in the first place, and that they're going to not have had any care. Well, that's not the case. And in fact, in Mexico, access to dental care is quite common and pervasive. And it's a different system than we have here. And so I think, but seeing that the migrant worker living transnationally, that is back and forth from year to year, and sometimes they've been coming to Canada for 20 years, 25 years, and that that's part of their health continuum, and there's a big gap when they're in Canada, and so.
Oh. Jenna, I think we lost you there for a sec.
Can she hear us?
Sorry.
Oh, we couldn't hear you.
The cultural specificities are also important around. Are we good?
Okay, we lost.
No, you're
Oh,
here.
can
You're
she
here.
hear? Oh, we
You're
can hear.
okay.
It. Yeah. Okay.
Okay. Okay. All right. Good.
Yeah.
Yeah. Well, I was just wrapping up to say that Aaron's point
Okay.
about
We just missed this.
that. So that's it.
Yeah. So one of the things that we were made aware of through Dane was that depending also it really, and so you just sort of made clear that in Mexico obviously people have access to dental care much more frequently than we're maybe aware of, and that treating the individual as coming in as a healthy person with the right to be healthy as well, as we all have. But does it vary from cultural, sort of from that perspective, from migrant worker to migrant worker culturally, like, because we have so many international migrant workers? So depending from what country do they come from, do they have different health care? Like sort of, I guess, is there a difference in their access to health care? Do they get more benefits? How does that work? So maybe that would be a dynamic to understand, and how we could reach out in that way as well.
I think there's two layers. Oh, you go first, Tara.
Okay.
Okay. Well, I think it's the system. It's how we like how can we answer to some kind of things. For example, here every time that you need like a prescription, I mean some like a pills, you need like a prescription. For example, now there's like a community health center here in Niagara that they start like a program for migrant workers on Sundays, okay? So this program started like a few years ago, and then some doctors, some students go there, and then also some translators. I was there, for example. And then the doctor, the migrant worker arrived, and then the doctor wrote a prescription, like this prescription, you know? So with this prescription and with this, the migrant worker can go to the drugstore and get whatever he or needed. For example, in Mexico, sometimes all these the pills or whatever you need, they give you there right away. You know, you don't need to go to the drugstore to get the pills. So, for example, that's a small thing that is very different. And for example, this what happened, the doctor didn't feel very good the prescription. So the migrant worker, he didn't went because I take care of this problem. So I got this and I went to the drugstore, and then the first problem is that the receptionist in the pharmacy start to asking me questions like what's the birthday, the address, telephone number, a lot of questions that in Mexico doesn't happen because they already ask you. They don't ask you again. And if you don't speak English, of course it's like just I came to pick up some pills with this, but no, they start to ask you questions, and then you start to get anxious and stressed. Okay, so I answer all these questions related with the migrant worker. So I stay there for an hour. You know, I have time, but migrant workers don't have time because they just have 30 minutes or 40 minutes to lunch time. So they arrive to the pharmacy, and they arrive, and then they don't solve the problem. They just start asking questions. So then I stay there for an hour, and then they say, okay, leave it this, because it's filling some information that the doctor didn't write properly. Okay. So they say, I will call you. Okay, but my telephone is from Mexico. Okay, whatever. So they call me, and they say, okay, the clinic, this Quest Community Clinic, they have not answered our phone call. So I say, okay, so next day, then 2 days, then I call them again. Okay, the pills are ready. Well, no, because they have not called again. So we will call again. So they call, and I say, okay, call me back to be sure if this is covered to the insurance. But I told them, 2 days ago, you told me that it's covered for the insurance. Oh, they say, oh, but we are not really sure. So we are going to call again. Okay, so after 3 days, to get just one simple prescription, they say it's not covered. So they say, oh, just you can go to Walmart and buy it. Okay, this is like in everything that something happened with health issue, oh my God, it's like a drama to really get the access. So at the end, the migrant worker has to go and buy by themselves and pay this thing for him. So like this kind of thing, it's every time. It's very complex, and I think it's the system because, for example, in Mexico, there are things. If you broke your leg, you go to the X-ray and you get right away. I mean, if you have the money or access, it's easy. But here, no. You have to go to the hospital and then stay there, and then after a while, they send you to other place, and then it's a lot of a lot of things that when you are Canadian, probably you can solve because you have a car, you have someone, you speak language, but with no transportation, with no language, with no, you know, the system, it's very like a chaos. It's like a chaos. Okay. Yeah.
Some of the ways that I think to address some of those barriers means going to them. I think that's something that we've learned is that you have to make it accessible so that they can reach it in small time frame without having to have independent transportation. So in the past, we've partnered work with Niagara Region Public Health that put together a health bus that drove around and provided some care. These kinds of examples work very well. Also, we've been working with OCAL, Occupational Health Clinics for Ontario Workers, to be able to have clinics on Friday nights in city centres, small towns, basically like in Simcoe and Virgil and Bradford and others, to be able to be there when workers are into urban, to small towns, to be able to get groceries. And so by having a clinic available in the off hours that is just for migrant workers has worked exceptionally well in terms of being able to provide some occupational health care. And those are two examples of things that work. So kind of rethinking the model of care. You can't expect them to necessarily come to an office either, and that's something that there's also kind of a concern and a general fear of seeking out care. There's a number of reasons for that. Sometimes it's just hesitation or trepidation because of language or because of the new system and being a bit timid, but sometimes it's more serious than that because employers have a great deal of control over workers, and if workers are sick or injured or for any other reason refuse to work, they can be sent back home. And so they don't want to be seen as ill by their employers, even if they are. Sometimes very serious injuries and illnesses, they will try to keep those from employers. And so that's a factor as well that has to play into thinking about providing access to care.
Something that we just from a local point here in Durham, a lot of things that we've been doing and that's actually been working is as mentioned, we go, we meet people where they are. We meet the farmers, the farm workers, where they are. So if it's meeting on a Friday, Saturday evening while they're doing their groceries and letting them know of a clinic coming up, it's what we do. It's necessary because it gives them the opportunity for those windows of time where it's everybody load up on the bus or whichever way we're traveling to get to town. For those that may not want to do retail shopping, grocery or whatnot, here's the opportunity for them to go and seek medical attention, go see a doctor, nurse, dentist, what have you. So these are the periods in which we operate locally to meet the farmers and to meet the farm workers. Now, the relationships with the farm owners, that's something that's always developing and always kind of up and down. There are times where we have been met negatively, and fair enough. Like it is at times invasive in meeting people where they are. But there are some great successes where some farms have actually said, well, you know, the guys are here, just come on to the farm, bring everything you need, and make the connection. Maybe there's something that we can help with that we don't know. Certainly being able to ask the questions and ask the questions in a way that are understandable for all sides, not only for the farmers, the farm owners, and the farm workers, but also for our own colleagues. Like it may be a question, Aaron, just the example of the prescription, for example. It might be a question where we need to, in our outreach work, educate the pharmacists themselves on how to ask the right questions to provide the farmers, the farm workers, with the right information. So things such as, hey, do you have a slip, or do you have anything that shows the mailing address of where you currently are in order to fill this prescription? That saves some time from the pharmacy side, but also on our end, it's important that we notify that we let the farmers know that, hey, when you're going, if you're going for the first time, bring this information and let them know that this is what you need, and they'll help you out. They'll help you out best as you can.
Can I add to that, Dane? Just to point that Janet and I did a project on that was funded with WSIB funding. It was called Bridging the Gap, and we did information sessions with healthcare practitioners across the province, and included pharmacists and a whole range of different levels of care, right up to hospitals. And one of the things that we, aside from obviously figuring out what kind of information they need, is ask them to sort of cut the bullshit red tape. Sorry, I know that's like a bit direct, but some of it, so much of the protocols are actually not required in order to be able to provide care or provide access to medication. Some of it's just for their system, and they're just sort of used to doing it, and they do it for other reasons and rationales that have to do with planning ahead for how many pills to order. So we asked them to think about finding ways to serve the migrant worker population a bit differently because of the realities of their situation. And so having those conversations like that, in some cases, has really worked. And the Simcoe Hospital, for example, does things a little bit differently upon when workers come in the door in the Norfolk Hospital. They'll track of them, they'll find out information, but they won't necessarily first jump to sort of the official processes right away. They'll start with providing care, and then they'll figure out the best sort of channel to get all the information that they need. We also talk to the caregivers a range of levels of healthcare and entry points into providing care or getting access to medication. Things like you have any information that's in other languages that you can just share. If not, you resource it. Much of that stuff is available, but just not necessarily on hand. So talking to them about that was key. And also recognizing that many migrant workers, aside from language barriers, face literacy barriers. And so they might not be able to fill out a form. And so to be able to think about those limitations in accessing certain
Any questions from the live class?
From the live class, anything.
Or
I think
comments, anything.
everybody's very tired, all the assignments they have to do. I can see everybody yawning. I'll ask questions for them though, because I can kind of think of what some of the things, because I know because we did something, it was called the Health Mission Outreach, and it was something that I had connected with Dane about, and we do it, and it's literally, it's a forum where people can come in and they can get dental care, like it's actually interprofessional, so they can get dental care, dental cleanings, they can see a chiropractor, they can see a physiotherapist, they can see an optician, a chiropodist. It's just a real big dynamic, and all the students here actually participated in that in June of this year. So I think probably from our perspective, and probably I know what a lot of the students are thinking, they just don't know, it's hard to sort of manage it, but I was even talking to Dane about it, is would we be able to maybe bring some of the migrant workers to our dental clinic, for example, because we do have opening. Now the students are actually almost running their own practice through our dental clinic because they're graduate students. So they manage their own appointment calendars. They know how to do these things. Like they basically are maintaining their own practice to a certain extent. So is there, now our thing is the barrier, we know that the employers, it's up to the employers, it's up to the time frame that they have to work. But would it be possible to negotiate something in which we could bring migrant workers to our clinics? That's one of our things. We have a lot of clinic options, not only for adults, but for children, etc. So, and then we could sort of create something that's maybe more of an interprofessional environment, because we do have nursings and RPNs. We now have massage therapy school. So there's occupational therapy, physical therapy assistants. So we have access to all of these things, but how could we somehow manage that within in these communities? I mean, if there was some way we could bring them to us, that would be helpful. Or how can we sort of initiate that contact sequence? Because Dane can only do so much, but we as in our community could probably do a lot more.
Can I go first?
Sure, there you go.
I think the better question is, what can you do to bring it out to community? We can in all of our locales across the province and nationally, that we can bring communities to the establishments, to the doctors, to the dentists and whatnot. And I think it's great that we've been able to do the best that we can within our own abilities and in some cases limitations. But I think in just the realm of thinking a little differently, I think there's certainly an opportunity where we can find a way from a community and from an institution to find a bridge to bring the work outside and just get the work done that way. I think what's important though is at least for me, is to find out what do you need in order to get out there.
Yeah, and that's a very complex thing when we're dealing with, like, in the health field, as you know, right? And even from a dental perspective, insurance-wise and transportation. And so it's sort of having those established communities already. But even now, like in this particular setting, would there be something we could do even in the immediate future? Because I know students are currently always looking for clients and patients. And we have this ongoing thing where how can we get more people in, and would there be some way that we could facilitate that type of, if we could do some kind of health symposium for a day or for a specific time frame, could that be a possibility? That's my question. Because I know in this whole class, I know there's always students looking for clients. And you can look at any of them now. And here's Rachel has a question over here as well.
I was going to say maybe not just from like them coming in as clients, but like all of us organizing like a volunteer night where we all come in on our own time, just because the hours aren't as flexible. But then of course we would need the staff as well, like you guys, to come in at like a later time.
That's see, there you go, wonderful students. So see, and that's Rachel's point is great. And that would be some facilitate. That was an excellent idea, and that's sort of what we're talking about, and that's our whole prospect. So we could it might not only just be us as dental hygienists, we could invite the occupational therapist assistants, and we could bring in, I don't know where the massage therapy school just started, but that would probably be good for all of us.
Yes.
But my point is, we can all benefit. But I mean, just creating that community. So that's what we're talking about. These students are all very proactive about it, and I think that's more sort of what this forum's about, is that they all want to help. They just we have to figure out a way to find our way through those avenues, and that was excellent, Rachel. And that's something that I could even help facilitate in this time frame of our semester. But we would sort of have to act, more quickly than less quickly. But I know that just by making our administration and, obviously the dean, et cetera, aware of this situation, we can have something happen.
Be able to get them to is what we did in the health clinics in Simcoe. In the first year they operated, we made sure there were buses so everyone, the micro became aware that we had health clinics, and so what we did was a bus was at a certain pickup point at a certain time on Friday at this time, and it would come, and they would know it would be there 3 times throughout the night, and we walked around with leaflets, and we got people to know about it, and then it was consistent. It was this Friday, we did it, every second Friday or something like that, and we bussed in workers to a supermarket where we held the occupational health clinic in the upstairs of a superstore. And so, getting a bus and a bus driver and printing some leaflets and getting some volunteers, that's really how you get them out. And you just would have to do it on the Friday night window. Sometimes Sundays, that's harder on your end, I think. Like keeping the space open and maybe making it something like not just a one-off, saying this 4 times this month or 3 times in the rest of the season, and see if we can use it as a pilot for the coming year.
Yeah.
No, that's a good idea.
I will back to Mexico November, probably end of November. So I will be very, very happy to meet you and plan this for next season. I'm volunteer now with Quest in Niagara-on-the-Lake. This was started through the IMRC with Jenna and Janet, these clinics. So and it's going pretty good. So yeah, we can plan and start something there next year. I have the contact with the Ministry of Labor in Mexico. Then we can map and know where are the farms around the place you can start, and then we can know how many people are, how many migrants, the name of the farm, the addresses, and then we can start doing this advertisement for the next season. But we have to plan soon because some of them start coming in January. So, but then we can start maybe in May, or depends of your agenda.
Okay, that would be wonderful. I'm just sort of thinking immediately now, because these students are going to graduate in December. Is there something we could maybe even facilitate in the near future? What do you think, Jenna?
Yeah, you could definitely do the one pilot idea. I don't see why not. I mean, you just need to find yourself a Friday between now and the end of the month, I think. I mean, the majority of work returns in the end of November, beginning of...
Okay.
So that's really your hard window closing moment, and I think the ideal moment to galvanize people is now.
Right.
This weekend of Thanksgiving, let's think about the harvest.
Yeah.
Let's get people to sign up, be on board, say, this Thanksgiving, would you give, a couple hours of your time and access to the facility, talk to whomever is in charge to be able to make it happen, push the Thanksgiving button, and say, let's plan to do one before the end of the month, and see if you can do one. Yeah. And if it works, it's great, and maybe if you're going to run it, you run it from 5:30 till 8, or 5 to 8, and you plan to have a bus that goes back and forth on a schedule bringing people to and from. And you basically identify the nearest shopping center where the workers come to get food, and that's where the bus goes and picks up, and you mark the bus clearly, you call it something, call your initiative something. I don't know what to call it. You could call it a health bus if you want, a patent on that. And just get people and bring them in, it could be good PR also for the college, so, those kinds of things. You just need to print some leaflets, and there you have it. Get Dane's help.
Well, that's it. We need Dane's help, right? Dane's the arbitrator here. And bus getting,
so
that's the other thing, right? Even if it was, you could do it?
Yeah.
So because that's something that's doable, actually. I could see that because we have the facility. Yeah.
It could be done, and I'm just seeing stuff in the background. I can't see behind me, but maybe hands up for the camera who would be interested in doing something.
There you go. We'll come. Yeah. So we could definitely facilitate. Yeah. So I mean, it is so you would definitely get people that could do that and come in for that extra time.
And then if you reach out to the other groups who said you had massage and something else, I forget what else it said, the occupational
physical therapy and occupational therapy. We have nurse practitioners as well. Yeah, so there's it's access to care.
If you get one or two, if you get two of each doctor or three of each doctor, or or each nurse or practitioner, or you just focus on one type of care. It's obviously, but
right. Yeah, absolutely. Well, we can just sort of put it out there and see what happens. But I mean, it's really about the mobility.
You can do it,
Yeah, we could. Well, and also I'm thinking of other contacts because we have the Health Mission Outreach. So we have people and doctors that might be interested in coming in. So, so it's not a bad thing that we could sort of facilitate. So
maybe with the people at Quest or at OCOW to get their advice.
Yeah, absolutely. That's great. Well, I think we're done. It's 2 o'clock, so that went very quickly. So thank you very much for all your input. And this is something we can certainly plan for in hopefully in the near future, but definitely next year as well, as Aaron talked about. And with Dane's help, we can facilitate it. I have 2 students that are going to do a field placement with Dane, and they can talk about it. And as well, like I said, as you see from the group here, we have a lot of very involved and interested students. So that kind of shows you that the help is out there. It's how to facilitate it. So thank you very much for your time, and we really appreciate it. All the best. You're going to Geneva, is it, Jenna, next week or this week? So all the best with that. That's well. And Aaron, safe trip back to Mexico, and I guess we'll see you in the new year. And send
I will share you my movie next year.
Oh, I'd love to see your movie. I'm a filmmaker as well, so that's something, and I can have that sent out to my students. They'll be blessed by then, so embarking on their new careers. But we often have them coming back and helping out with many of these initiatives. So this has been really wonderful. Thanks for making us more aware. Really appreciate it. Thank you. Okay, great. Thank you.